Executive Director of the World Health Organization Office to the United Nations, and she is going to give us an overview of global health concerns and priorities and WHO's work in trying to blend mental and physical health initiatives.
Thank you. Thank you, colleagues. Thank you, students, and all those who have come here for this noble cause. It's a great pleasure and an honor for me to represent the World Health Organization in this gathering. I must admit that it's not very often and very regularly that we meet with this kind of audience, where we have people who are doing a whole variety of range of things which are so relevant for keeping us all healthy and balanced and happy, and that's why I'd like to give you a little overview on where we stand globally on the mental health area, what are the challenges, what is being done, and how does this all connect to the Sustainable Development Agenda 2030, in which we, UN family at large, are very much involved and trying to push this agenda forward, and where we definitely will not succeed unless we have a massive, solid, very consolidated and wide-reaching movement of all concerned groups that can contribute to this movement. Of course, I'd like to thank the organizers of this event, the sponsors of this event, and that's a great honor to work with you. We all aware of massive work that you are doing in this area. So I'd like to also bring to your attention that maybe before I start with some of the statistics around the mental health, that we are this year in September organizing United Nations high-level meeting at the UN General Assembly, where heads of states will be present, and this will be a kind of a culmination of political attention to this very important area. Next slide, please. On this slide, next one, please, yes. On this slide, you see some of the mental health statistics, which I'm sure many of you are aware, and you can see them on websites, so I won't go much in that details, but you can see also that depression is a very prominently placed disorder in this list, and that we also have to be aware that it is growing, and in 2030, if nothing being done, it may become the leading cause of disability. So severe mental health disorders such as schizophrenia and related conditions, but also bipolar disorder and moderate to severe depression affect almost 4% of the adult population. Okay, and every 40 seconds we are seeing one death from the mental health, mental disorders, and this is collectively more than all the wars, conflicts, and natural disasters take away from us. It's not always spotted that way, but we have to be aware that it is more than malaria or breast cancer takes away from us. So I think it's therefore really deserves a lot of attention. And it's also a kind of a myth that most of the suicides are taking place in the well-developed countries, but actually the 75% of them is taking place in low and middle-income countries. So I think that already tells us a lot, especially if we look at the also adolescent group. Then we see that it is actually leading cause of death for girls between 15 to 19 years. Of course, it affects also boys, but for girls it's number one. On the next slide, I'd like to bring your attention to the disease burden and its distribution in the various age categories. You can see here on the, oh, it doesn't come. As you can see, there are 3 types of Okay. There are 4 knobs, so I thought I tried them all and none of them worked as effectively. So you can see here distribution of the disease burden measured in the disability-adjusted life years, which roughly means that 1 year of healthy life is lost to those disorders. And you can see that in different ages it takes more lives. So peak is in early adulthood, and between 20 and 30 years we are seeing a lot of burden on this very most important, perhaps most productive years of life for everyone. And if you also look at the next slide, where it shows you that if you take an overall group of adolescents, then you'll have it on the 3rd place if boys and girls are put together. So depression is a very important one, and it kills a lot of adolescents every year, in range of 3,000. So why do the people with mental disorders die early? First, I want to mention that it's indeed 10 to 20 years less that they live generally, and surprisingly they don't die because of mental illness, but they die because of other diseases such as cardiovascular diseases or infections or some kind of respiratory diseases and so on. And I want to emphasize this linkage because in WHO definition we always say that health is overall physical, mental, and social well-being, and not just merely absence of disease or infirmity. But I'd like to make these linkages very clear. Without mental health, there is no other health. So we'll be losing people to other diseases because they have mental health. And it's also important to note that it is true that people with mental disorders are 2 to 4 times more likely to die in natural causes such as suicide or homicide or accidents because of their mental issues. And of 50% of those who are dying from suicide, you'll find some mental health disorder present, depression, and so on. So that's why we have to think about those things, and we have to take into consideration a huge stigma which is attached also to mental health challenges. That's why the United Nations in 2015 came together, all the member states, and they have negotiated 17 Sustainable Development Goals. I'm sure you know about many of those goals. One of them is Goal 3, which is dedicated to health, and it is about ensuring healthy lives and promoting well-being at all ages. And there is a target under that which is looking at non-communicable diseases and mental health. And it's also important that the difference between Sustainable Development Goals and Millennium Development Goals, which some of you may know about, is very big. Because in Millennium Development Goals we had very specific diseases, for example, that we targeted. Here you will see health as a cross-cutting issue related to every Sustainable Development Goal, and all of those goals are very much interlinked. Like poverty goal is interlinked with the health goal and energy goal and all that. Inequality is a very important determinant also here, because people with higher social position, with better quality of life, they get less stressed and less depressed and less sick. So we need to deal with all those issues in a common, integrated manner, and we need to be sure that the huge amount of resources which is drained in every health system to treat the non-communicable conditions and mental health disorders is not growing and is not taking these resources from some other more useful things to do. So target 3.4 in the Sustainable Development Agenda is looking at the mental health as part of our efforts to address the non-communicable diseases. And WHO, of course, has put mental health a long time as a priority. I already mentioned the definition that we are using where mental health is very well present, but we have also done launching of some action plans. One of those is currently ongoing, and these are some of the objectives that are stated there. You can look at them later on. We are working towards accomplishing these objectives together with our member states. And yeah, another issue is, of course, a huge gap that we are facing. Gaps are everywhere. Gaps are in the service coverage, so people don't get diagnosed with mental health, mental disorders. They don't get access to services and treatment in particular. And there are huge differences also between the countries. Like in developed countries, you'll have a better access to services in the range of 22%, for example. The treatment is accessible, but it's much lower in low and middle income countries, such as 11 to 7% or even less. And within that, we also should be aware that despite of this high prevalence of those diseases and such a high burden and such a high risk it brings to our productivity of our societies, only 3% of overall health budgets are currently invested into mental health on average, maybe in the range of 5% in the developed world and in the range of 1% in the developing world. So there's a huge gap which is supposed to be covered by this intervention of the gap intervention guide of WHO. In addition to that, we do produce atlas of diseases and their prevalence, but we also produce atlas of what are countries doing, what are their plans, what are their financial resources allocated to that, what are their information systems condition, how do they tackle really this challenge. And we also have a regular collection of information to measure the gaps and what happens with these gaps. And we also have more specific initiatives to address mental health in emergencies. As you know, world is constantly in a crisis situation. We are at any given time involved as WHO on average in 50 countries in crisis situations. And of course, with all these displaced communities, people affected by man-made or natural disasters, mental health is a big challenge. And therefore, if there are no well-functioning health services and communities who can engage with those people, then we will be seeing even more problems and more difficulties in targeting those particular vulnerable groups. So that's one of our priority areas for engagements. We have been working in many countries. Some of those countries are listed on this slide that you can see. So we have been working to help governments to provide the necessary services. And I'm sure, as you are doing with your own neighborhoods, and many of you are very involved here, we are trying to mobilize local communities to engage and support their fellow citizens. The 2017 World Health Day, some of you may remember, it was dedicated also to depression. 7th of April is WHO's birthday, and every year we take one of the themes which is very common to every country. And that's why depression came as one of those big challenges that every country is facing, and we have celebrated that whole year by the dedicated events and a lot of advocacy to deal with depression. And not just through medical treatments and medications, but a lot also by social engagement, by creation of support groups, by talking to those people who feel they are sad, who feel they have problems such as maybe job loss or some personal tragedy, or they are marginalized, or they undergo through social exclusion or violence for that matter, especially for women. And that's why women are more, there are more women that are depressed than men. Because the violence is also a very important factor. So we are promoting not just pharmacological interventions, but also self-care and community support. And we try to destigmatize depression from not being a kind of a brain disorder, which is what makes it difficult socially to accept, but we are trying to promote grassroots approach and try to destigmatize it as much as possible. And those kind of interventions, like making it acceptable, making it a normal thing to have those moments in life, is a very important strategy to tackle growth of depression and ending stigma and championing the self-care in addressing depression. In terms of costs, it is a huge burden on the societies globally, and it is estimated that if we just widen